Thanks, y'all. Thanks for being here. I'm actually, there's a little bit of serendipity that I'm here at all. As Marianne said, my folks live up by Lake Martin, and we're down here kind of on vacation, and we've been following what's been going on in Alabama. I have through the national press, and you may be more familiar with gambling issues, suits and countersuits, and what's legal and what's not, and the governor's task force and this and that. We've been following it from a slightly different perspective, in that we operate a nationwide helpline on problem gambling. Last year alone, that helpline took 270,000 calls. Now, not all of those calls are crisis calls, of course, but and you'll see in your handout, a decent number of them are from Alabama. And what our concern is that we have nowhere to send these calls. So they're answered by the generous help of our Florida chapter, the Florida Council on Compulsive Gambling, because there are no public or private resources here in the state. And as you heard from Roger this morning, the ones that are crisis calls, I mean, I can't tell you how frustrating it is to know that we'll have 20 or so calls today from Alabama, and one of those that is a crisis call, we can basically tell them, go to the internet. It might be a GA meeting in Montgomery, so you might be driving 4 or 5 hours. That's it. And to be on the other end of that line, to hear somebody in tears, family member in tears, looking for resources. Why isn't there help? They're asking us this. Why can't you do anything? It's not necessarily my problem, but it's my responsibility. And that's just, I'm sharing that with you in sort of a personal manner, because the fact that you're here is how we're going to start to address this problem. And the fact that enough of you at very short notice were able to come here because you recognize from your own perspective that this may be an issue, that there's something here that we can do that's a positive step. Because so much of the debate right now has been polarized, pro-gambling, anti-gambling. Pro-gambling, anti-gambling. Is it good for the state? Is it bad for the state? Well, we see gambling as an is. It's how you do it and why you do it. It makes all the difference. So, I'm here on vacation, but when Marianne calls, and this has been sort of this push-pull, because I call Marianne, and then when she calls back, we both sort of tend to work each other into doing something that we might otherwise have wisely avoided and stayed out of the limelight. But since I was going to be here, I thought this is a tremendous opportunity. I'm so grateful for the Alabama Council for getting together, for Reverend Olson for sort of organizing this training, and most importantly for you all to be here. I know that you've got other stuff that you might well be doing. Some of you might be here because you want more information. Is this really a problem? Some of you might be here because it is a problem. But so what I'd like to do a little bit is take a step back. I think we started with a very great explanation of, on a counseling level, how this does fit the disease model, which we clearly believe it does. What I'd like to do is, in the 13 years I've been working on this issue, and as we've gone around the states and around the world, talking about gambling, I think there's probably a lot of preconceptions you have. I think there's a lot of information you may have, and there's a lot of information you don't. Gambling has changed radically in the United States. And so I'd like to kind of step back and give you a larger sort of, national eye view of some of these issues, and then tie it back into Alabama. And then in the last session, we're going to talk real specifically about what some of the next steps are with the Alabama Council, what some of the next steps are for Alabama. So let me just start off by, since it is a small room, I almost don't even know that we need PA, but I would like this to be more of a conversation and less of a lecture. So I'll know I've failed if there's not some questions from the audience. All right, there's not going to be any quizzes, but what I'd really like is for us to kind of have some dialogue. As I present some of these statistics, feel free to challenge me on a question. Let me know what it is you want to know, and we'll try and have some dialogue, because that's where I think people learn the best. So I'm just going to lay out some of these things almost as talking points, and then you can help me fill it in. Because the National Council, we're the national advocates for programs and services for problem gamblers. In states like Alabama, we also have to be a service provider. But what we do, especially through our 35 state chapters, is we try and make sure that these services are available. And I think that's, as much as you need service providers in Alabama, you need a voice. You need a chapter here. You need advocates to speak up and say, this is a public health issue, and this is a preventable and treatable disorder. There's help and hope available. It's just we've got to get the resources in place. So we've been around since 1972. Often we get this question, now that gambling's expanded in the United States, now that casinos have come to Mississippi, I guess, you guys, really got started. Yeah, we were around when gaming was pretty much Las Vegas, even before it came to the East Coast of Atlantic City. We're neutral on legalized gambling, and especially given the debate right here, let me spend a little bit more time on this than I do with some of my other audiences. Neutral on gambling means that we believe most people can gamble without harm, much like most people can drink alcohol without harm. However, there are some groups that cannot gamble without harm. That includes the youth. That includes other folks that are disadvantaged. And that includes, obviously, problem gamblers. So we believe that these groups together create a social policy concern. One, when you start to look at the statistics, I'll tell you, when you start to look at the numbers, almost everybody in America gambles. So we've got to do prevention and education messages for the entire population, because just about all of us gamble in one form or another at some point in our lives. Now, when you start to look at these vulnerable populations, you have to step from prevention education into real targeted services to help make sure that kids don't gamble, and that if adults do gamble, that they have the correct information and they know where to get help. And I'll elaborate on this later. So, as an advocate for problem gamblers, we don't blame the gambling industry. We don't blame the individuals. We want to be there to help them. So we're not out to encourage or disapprove of the gambling industry. Because we're neutral, and because we need funds to do our work, we take donations from anybody, including the gambling industry. I just want to be very upfront and clear about that, from the start. We believe that anybody that operates gambling has an obligation, has a responsibility, has a duty to provide some of those funds to mitigate problems that they help create. And so we believe in Alabama that certainly the folks that operate these bingo centers should be chipping in. But we also believe the state of Alabama, whether or not they think gambling is legal, should be providing some public funds. Now we know that's, it's tough. Alabama, like most states, has a budget deficit and all that kind of things. But nobody's gone and legalized diabetes. Nobody's gone and legalized cancer or drug abuse. And the state of Alabama provides some public funding to help mitigate and minimize the impacts of that. Because we know that services to prevent and treat addiction are more cost-effective and more ethical than just letting the problem fester. And so as we go through this, I'd like you to keep that in mind. We want to be the advocates. We want to bring together all the stakeholders, including the gambling industry, including government, including the tribes, including counselors, clergy, anybody who's got a stake in gambling. Anybody who has a stake in alcohol or drug abuse probably has a stake in gambling. So, why do we believe this is a national issue? Why was our group founded in 1972? When you start to conceptualize it, we use this in Congress a lot, the 7 Ps. And so we say presence. It's legal in 48 states and about 2/3 of federally recognized tribes. You look at participation, 85%. Now, who would be surprised by that? 85% of adults have gambled at least once in their lives. And when you start to break it down, 65% at least once in the past year. Does this seem like the United States that we grew up in? That more than 2/3 of adults have gambled at least once in the past year? I can tell you that's a 50% jump over the last 20 years. You start to break it down even more, 15% have gambled for money at least once in the past week. This starts to look a lot like tobacco use. It starts to look a lot like substance use. This is something that's widely participated in. We may not be, we are, my pop cultural theory is that we are a nation of risk takers. We're a nation of entrepreneurs. We're a nation of business folks and warriors and executives. Our ancestors didn't cross the ocean and stop at the Appalachians. They didn't stop at the plains. They didn't even stop at the Rockies. Hell, they didn't stop at the Pacific. They kept going. We didn't invent the stock market, but we perfected it. Or, well, we thought we did. Until the events of the past couple of years we figured out. And talk about gamblers. Those guys on Wall Street. It's the alpha and the omega of how we've always seen. But we've always been, we've always been these risk takers, but we've always been sort of skeptical of those who take too much risk. Well, how much is too much? Well, that's obviously a personal thing. But I would just say that gambling is now part of our fabric, it's part of our culture, and now if you look at these numbers, it's an everyday activity for the majority, it's an everyday. It's an activity that the majority of Americans do. Whether you like it or not, whether it's legal or not. And this is just participation in some form of gambling, legal and illegal. And then you look at profits, or proceeds rather. $95 billion a year in legal gambling revenue last year. 95 billion with a B. Okay, it's hard to see on the screen, but if you tell me that there's another industry that brings in $100 billion or $95 billion a year, just the legal part of it alone, that may be matched even or doubled by the sports gambling, illegal internet gambling, and you tell me there's not that's not a national issue. Then we talk about, obviously profits. The federal government, what a lot of folks don't know, some of you that are gamblers, and some of you that may have won more than $3,000 once, will realize that you pay a 30% federal withholding tax, a special federal withholding tax on individual gambling winnings. That brought in almost $7 billion to Uncle Sam last year alone. So the federal government, we believe, has an obligation both as a public health issue and just as, again, if you're profiting from gambling, you got to return a little bit back to mitigate and minimize. We believe they, through the profit, should be helping the states more than they are. Then you look at, obviously, gambling problems. About 2 to 3% of the adult population will meet criteria for a gambling problem in a given year. And you start to do those numbers out. It's between 6 and 9 million or 6 and 8 million adults, plus about 500,000 adolescents. And then, last but not least, when you look at the social cost of gambling problems, you're looking at about $7 billion a year from addiction, bankruptcy, and crime. So, this would be my argument. When I'm on Capitol Hill, when I'm talking to representatives, they say, well, gambling, that's a local issue, or, I don't really think that's an issue for my district or my state. So, we think it is, with all due respect. We think this is something that's gone under the radar screen. Maybe not here in Alabama, because it's a huge current issue. But in most places, the evolution, the expansion, the expanse of legalized gambling, I think surprises a lot of folks. So, what is it that we're talking about when we talk about gambling? Sometimes you have to really step back to first principles. And like I said, I'm not trying to talk down anybody, but sometimes it really helps to think about that this is one of the reasons it's tough for us to do is it's so deeply rooted in our culture. All right, it's one of the oldest activities that we know of because for a long time we've tried to find, what's going to be the outcome of something. What's the will of the gods? What will my fate be? Should I choose path A, path B? In fact, some of the oldest, some of the only quiz stuff I'll do right now. Why is it that dice, and some of the oldest dice we found, have pips on it instead of numbers? Wouldn't it be a lot easier if you could just roll those bones? Okay, there's a 3, there's a 4. Okay, that's a 7. Why does anybody think why you might use pips instead of numbers?
Because people didn't know how to read numbers. They count
That's exactly right. Dice were created almost 3,000 years before the Hindu-Arabic numbering system. We were trying to find the will of the gods and rolling those bones literally thousands of years before we even created numbers. And again, as I said earlier, I think Americans are more prone to take risks. I think it's in our DNA. I think that's generally a very, very good thing.